Hey everybody, this is Dr. Greg from Judice Sports and Rehab. This is my very first Facebook Live video, so if it's not perfect, cut me a little slack today. So the first question is, give me some suggestions for recurrent tennis elbow that extends into the wrist and also into the neck area. So the first thing I'm thinking there is with tennis elbow. Tennis elbow is typically a musculoskeletal issue, so thinking tendon, muscle, and that's around the outside of the elbow, okay? The fact that it's recurring and it goes from the wrist all the way up into the neck makes me think there might be a nerve involvement there as well. So it's really hard for me to give you a whole lot of advice on nerve pain, because if I give you any advice on that, it could actually make it worse. So I would definitely recommend that you go get checked out. I know who asked this question is not in the St. Louis area, so be sure to go see a therapist and go get looked at for that. What it could be radial tunnel syndrome or something involving the shoulder or neck. As nerves travel from the neck down to the hand, they will pass through that elbow region, and they can have a compression there through that elbow region. Could be part of your issue there. I would want to know more about the activities that bother you, how long it's been going on, and then if there's anything that you do currently that helps to relieve that pain. If it is radial tunnel, I can't diagnose over the phone, but I do want to be able to provide a link for you. I'll put a link in this video underneath talking about radial tunnel syndrome. It's a link to my website. It's a nice little article. Recommend you take a look at it and see what you think. Second question is, what's better, ice or heat, when dealing with elbow nerve pain? Again, nerve pain, we want to find the source. We don't necessarily want to just treat the symptom of nerve pain. So I would highly recommend that you get assessed to see exactly what's going on and causing that pain. All that being said, you can still treat the symptoms to an extent with either heat or ice. There's not a whole lot of evidence saying that heat or ice is better for a nerve pain, so I would just, whichever one you prefer, whichever one you like. If you like to alternate, if you hate the ice and want to try the heat only, that's totally fine. Again, it's whatever helps you and whatever helps your symptoms the most. And again, we just really want to find the cause of that, or the source of the pain, not just the symptoms. Because if it's a nerve-related thing, we need to make sure that that's not an ongoing problem that lasts a long time. And that's all the questions I'm going to answer today. I want to save a few for next week, and I will be back next Friday to answer some more questions. So keep commenting more questions. We'll put some more posts next week, hoping to get some more questions.